morning, ladies and gentlemen. It is a big pleasure for me to welcome all of you. And in a moment where a conference for which we were working since months, I should say, more than a year, so intensively that it now has become reality. We are very pleased that we shall have around 170 colleagues and health officers, epidemiologists, and also politicians here today. If I calculated from the list of announced persons well, then around 40 politicians should arrive today, members of parliaments and ministries from the EU Commission, from the EU Parliament, should come here. We cannot expect that they spend the whole day here, but at least they will drop in and listen for a while. What is even more important, perhaps, is that we have collected real experts in the field of colorectal cancer screening in Europe here. Now, welcome to all of you, and it's my pleasure now to announce the General Director of the Ministry of Health of the Free State of Bavaria, a significant part of Germany, perhaps the most significant one. This is Carolina Gernbauer. Please give us your welcome address.
Dear Dr. Christa Mahr, dear Professor Claassen, esteemed members of the European Parliament, the European Commission and the Council, ladies and gentlemen, I would like to warmly welcome all guests. Thank you. Also in the name of the State Minister, Dr. Schnappauf, to the European Conference on the topic of preventing colon cancer in Europe. Unfortunately, Minister Schnappauf had to cancel his attendance here at short notice due to another commitment he has undertaken on behalf of Minister President Dr. Stoiber. I do apologize for any inconvenience. I am very pleased that this international event, attended by high-ranking people, is taking place in the mission of the Free State of Bavaria in Brussels. Since 2004, these buildings are the home of the Bavarian representation. The main complex was originally designed by leading architects of Brabant and named after the great French pioneer of microbiology, Louis Pasteur. In fact, it served as Pasteur Institute of the University of Brussels and was first directed by the Belgian physician Jules Bordet, who was awarded the Nobel Prize in Medicine in 1919 for the discovery of Bordetella pertussis, the bacterial cause of whooping cough. I hope the ambience will inspire discussions about an urgent health problem of our days: quality-controlled colon cancer preventive care in Europe. Preventive care for colon cancer has been handled in various ways within the European countries up to now. As a result, it is a very welcome development that the EU has commissioned the formulation of a new guideline or recommendation for the early detection of colon cancer. Colon cancer has developed into an epidemic disease in the industrialized nations, which is still on the rise in the Western countries. It has now developed into the most frequently diagnosed new incidence of cancer throughout the EU, with about 400,000 cases per year. About one half of these tumor patients still continue to die from cancer. There are about 200,000 deaths per year in Europe. In Germany alone, there are 71,000 new incidents of colon cancer per year and about 30,000 deaths. These alarming and frightening figures could be considerably reduced. Patients with colon cancer have good chances of recovery, in contrast to many other types of cancer, provided that it is detected and treated at early stage. This is why preventive checkups are absolutely necessary to curb this disease. Cancer prevention saves not only human suffering, it is also a wise terms of the economic aspects. Colon cancer treatment in the early stage, including an operation, costs about 36,000 euros. Afterwards, the patient is considered healed. The treatment in the advanced stage costs about 200,000 euros. However, the most of these patients survive for less than 2 years. Most EU countries use a test for hidden blood in the stools for colon cancer preventive care. Austria, Italy, Poland, and Germany have the possibility of additional enteroscopy, which is covered by insurance companies. In Germany, 1.7 million people participated in preventive colonoscopy since 2002. This corresponds to about 8.8% of the entitled men and 10.2% of the entitled women. Over a period of 10 years, this means a participation rate of 30%. On the international level, this value is above average, but must further be increased. In 2003, Bavaria ran the first colon cancer campaign in Germany with many public campaign days and information material. An evaluation in 2 administrative districts showed appointments for about 11% of the preventive checkups were made as a result of the campaign. This year, an updated brochure was edited in cooperation with the Felix Burda Foundation. Another important step for effective colon cancer preventive care is controlling the quality of the preventive checkups. Effective measures have been introduced by the Association of Health Insurance Physicians in Bavaria for safeguarding the quality of colonoscopy. Important data and knowledge for the fight against colon cancer can be obtained by the Population-Related Cancer Register, funded annually with 2 million euros by the Bavarian government. Bavaria registers all cases of cancer that the physicians report. The various causes for colon cancer have not been completely clarified to this day. In addition to a hereditary disposition, a lack of exercise and an improper diet seem to play an important role. A balanced diet and exercise reduce more than just the probability of becoming overweight. They also reduce the risk of contracting colon cancer. It has long been considered an established fact that smoking and excessive consumption of alcohol also increase the risk of colon cancer. This means that each of us is also required to take responsibility for our own health. This is where the health policy of the Bavarian state government comes into play. It strengthens the idea of prevention and personal responsibility. As the first German state, however, Bavaria started a public health initiative more than 3 years ago. In the double budget 2007-2008, about 5 million euros have been included per year as project funds. A main emphasis of the initiative for healthy nutrition and regular exercise beginning in childhood. Ladies and gentlemen, the health policy goals of the Bavarian State Ministry of the Environment, Public Health and Consumer Protection are supported by institutions like the Felix Burda Foundation, which has carried out many activities and campaigns that create media attention to help reduce the rate of colon cancer. Since the beginning of the screening, colonoscopy in the year 2002, there has been a 10% decrease in the mortality rates. In 2002, 30,000 people died of colon cancer in Germany. In 2005, 27,000 people died of colon cancer. Ladies and gentlemen, we have a common goal: to reduce the incidence and fatality of colon cancer throughout Europe. To reach this goal, we must focus and link existing resources and activities and use the experience of other countries in the battle against colon cancer. This conference is a first important step towards an internationally linked screening program. I would like to express my sincere thanks to all those who have initiated and realized this conference. It's an initiative of the Felix Burda Foundation, the Network Against Colon Cancer, and the International Digestive Cancer Alliance. I wish the conference a successful course and hope that it brings us a big step closer to our mutual goal of reducing colon cancer. And I hope you have a nice day here on a Bavarian place. Thank you very much.